Welcome to the Get Healthcare podcast. In this series, we're going to look at understanding common conditions. Today, we're joined by Dr. Nick Flynn. Thanks for joining us today, Dr. Nick.
Hi, Dylan. How are you getting on?
Very good. No, very good. So today, we're going to take a look at high blood pressure, and we're going to run through some topics on it. And first off, we're just going to look at what essentially is high blood pressure. So if you could explain that to us, Dr. Nick, it would be great.
Thanks, Dylan. So high blood pressure, or in the medical term would be hypertension, is a condition where the force of the blood against the artery walls as it flows around the body is too high. So basically your heart pumps blood down the arteries or down the blood vessels to the body's organs. So it has to go from your heart to your organs like your brain and your kidneys, for example, the eyes. And the higher the pressure in the arteries, or the higher the pressure with which the blood is pumped, the more strain, one, is placed on the heart as a pump, and two, the more strain there is on the organs who are receiving the blood. So high blood pressure normally doesn't have any symptoms, and the only way you find out is to get your blood pressure checked normally. But the reason why it's so important is that because when the pressure or the blood pressure is high, it places strain on the pump, on the heart, leading to heart problems. And it also then can do what we cause end organ damage, or the organs to which the blood is being pumped can also be damaged by this high pressure, and that includes the brain, the eyes, the kidneys, So we can get lots of complications of high blood pressure, which lead to people feeling unwell, although the high blood pressure in its early stages in itself tends not to cause any symptoms.
Okay. And now that we know what high blood pressure is, what is it not? So, I suppose it can probably, I do hear of it frequently when people think that they have high blood pressure, but essentially they don't have high blood pressure.
So it's not uncommon that patients will have symptoms that they may attribute to having high blood pressure, whether it's headache or nosebleeds or dizziness, and all of those things can be caused by high blood pressure, but most commonly patients with high blood pressure don't know that they have it. So the only way really of getting checked is to go to your GP or your doctor or your pharmacy or your local health clinic and have a blood pressure check. So you can also buy these blood pressure monitors and have and check them at home, and it'll give you two readings. It'll give you a diastolic and a systolic reading. So most people are familiar with getting two readings in the blood pressure, the diastolic and systolic readings, and you'll get them as one figure over another. So the systolic is the top number and the diastolic is the bottom number, and we would like that to be below 120 over 80. We normally now define high blood pressure as having a blood pressure of greater than 130 over 80, and previously we used to regard that as 140 over 90. So 140 over 90 would have been, when I qualified first, what we regarded as being high blood pressure to be above that. But over the years, we've come to recognize that normal blood pressure is very important, and that we should have tighter controls in order to prevent the damage to the pump and the damage to the end organs, the brain, the eyes, the kidneys, etc. And now we regard high blood pressure as being a blood pressure more than 130 over 80, and those measurements are in millimeters of mercury. And as I say, it's possible to buy a very accurate home monitor if you want to check this yourself, or you can attend your GP, health clinic, or local pharmacy and get it done as well. So I would say as well, for people who are wondering should they get their blood pressure checked, we normally recommend that people over the age of 40 should have a blood pressure check once a year, and that adults between 18 and 39 or 18 and under the age of 40 probably it's okay to get it every 3 to 5 years. It's very normal. Every 5 years is fine under the age of 40. But we do recommend that adults over the age of 40 should have an annual blood pressure check as part of a checkup or your health visit.
Okay. Are there different types of high blood pressure?
There are. The most common type, and it's 95% of high blood pressure, is called primary or essential hypertension or high blood pressure. And this type is the type that most people have. Develops gradually over years, and it's called essential or primary high blood pressure because we don't know the cause. It's still very important that it gets treated, but we don't know the cause of primary or essential hypertension. So most people, commonly when they come to the doctor, will ask us about, well, why have I got high blood pressure, doctor? And there are certainly some risk factors that can lead to it. People's age is more common as you get older. Family history, again, more common if you have a family history of high blood pressure. Obesity, if you're overweight, and the sedentary lifestyle is certainly more common. High salt intake, excessive alcohol, and smoking. All of those things can contribute to the essential hypertension, but what the actual mechanism or cause of essential hypertension, we don't really know. And then there's another type of hypertension called secondary hypertension, which has a cause. This is 5 to 10% of cases of people who have blood pressure, and that would be such as kidney problems, hormonal problems, sometimes painful conditions. So people who have pain can often have high blood pressure. People with anxiety can sometimes present with high blood pressure, and certain medications can have a complication of causing high blood pressure. But I suppose to answer the question, most people, although they may have risk factors which can include, age, family history, obesity, sedentary lifestyle, high salt intake, excess alcohol consumption, and smoking. When they may have risk factors, for most people we don't know the actual cause, and then for a small group of people with secondary hypertension, we do know the cause, and that can be kidney problems or hormonal problems or sometimes medication.
Okay. Are there any other risk factors that you'd like to look at, I suppose, that would be associated? I know you did kind of run through a good few of them there, but are there any others that you can think of?
I suppose when we think about risk factors in general practice or in primary care, we tend to think about them in two main categories, and they would be risk factors that you can adjust and do something about, and risk factors that you can't. So your age, your sex, your family history, you can't change any of those, but you can change things like your weight, your lifestyle, how much exercise you take, how much salt you take, how much alcohol you consume, whether you smoke or not. You can control those types of risk factors. So they're the ones that we ask people to reflect on and to concentrate on, what we would call the adaptable risk factors for hypertension. And another one that's becoming more and more frequent that we're seeing would be for people with poor sleep patterns. That can be just through bad habits of not getting enough sleep, but also a condition called obstructive sleep apnea. So I suppose that's one we haven't mentioned this evening so far, but not getting enough sleep. Sleep is an important restorative function for the body, and so not getting enough sleep can certainly lead you to develop or be an additional risk factor to developing high blood pressure. And separately, people who have obstructive sleep apnea would be at risk of sleep apnea would be at risk of hypertension. And sleep apnea is something that we might talk about in a separate podcast. Actually, it's a fascinating condition, very common, and it's got significant, prognosis and significant prognostic indicators for patients who have it, and can be very effectively diagnosed and treated. So we might talk about that on another podcast then.
Okay. And then some of the complications that can come from high blood pressure, if you want to run through some of them.
Yeah, I suppose we've kind of discussed them there, but really if you think about it, there are problems in the heart. So because the heart is the pump, and if the pump is working against this high pressure, you get heart disease, which can include atrial fibrillation, which is an irregular heartbeat, which is a risk of stroke itself. Also, you can get heart failure. So the heart failure occurs when the heart as a pump doesn't pump blood as effectively as before around the body, leading to problems with shortness of breath as fluid accumulates on the lungs, and edema or swelling of the legs as fluid accumulates in the body. So atrial fibrillation and heart failure will be common complications of high blood pressure for the heart or the pump itself. And then for the end organs, remember we spoke about the heart being one of the issues for hypertension or high blood pressure, but also when the blood is being pumped at high pressure through the arteries, it's arriving in the end organs as at high pressure, and this can cause kidney disease, it can cause stroke itself, and it can also cause problems with eyesight or vision and visual impairment. So really it's very important that blood pressure is picked up. We talked about who should get checked earlier. So over 41 years of age, you should get a blood pressure check once a year. Under 40, every 3 to 5 years is absolutely fine. And again, important to remind people, Dylan, that hypertension is very often there's very often no symptoms, and it's often called the silent killer because people don't know they have it. Although some people do present to us with headaches, dizziness, shortness of breath, and nosebleeds, that turns out to be hypertension related. The vast majority of people have no symptoms. Okay.
And then from a diagnosis perspective, if you want to speak to kind of, I suppose, getting an official diagnosis.
We spoke earlier about getting a blood pressure check.
Yep.
Blood pressure monitors are called sphygmomanometers. You can buy these very good quality sphygmomanometers now in most pharmacies and in online medical supply providers. But the gold standard for diagnosis and treatment of high blood pressure or hypertension is to have a 24-hour blood pressure monitor, and these are principally done with your GP, but there are some pharmacies who also offer this as a service. And it's basically the blood pressure cuff will be applied to your arm, a little small cable that goes into a little monitor that is normally on kind of a belt that goes around your waist or over your shoulder, and this will blow up over the course of 24 hours, normally 30 to 40 times, and it gives a good indication to the doctor that's looking at the results of is your blood pressure actually up? Because sometimes we get what we call office hypertension or white coat hypertension, and while this has a clinical significance itself and shouldn't be ignored, I would often see patients that have office hypertension but then have an absolutely normal 24-hour blood pressure monitor. So just this last week I had a healthy 51-year-old gentleman come in to me. He had no past medical history, a non-smoker, quite physically active, and his office blood pressure was quite high. It was 160 over 90, it was in that range. And when we did the 24-hour blood pressure monitor, which included him doing a very busy shift in his own job, which he found quite stressful, but his blood pressure monitor showed that he actually had normal blood pressure and very normal blood pressure, all within range throughout the 24 hours that he was wearing the monitor. This was very reassuring, and in this case we were able to reassure this patient without the use of medication. I think that brings us probably nicely onto the treatment of blood pressure, and like most medical conditions or long-term conditions, the first treatment that we should consider is a non-drug treatment. So, our lifestyle changes, so a healthy diet, low salt, exercise, managing your weight, reducing stress, getting enough sleep, all of these can help to lower our blood pressure overall. Of course, some people then who are diagnosed with high blood pressure will need medication, and there are different classes of medication. And what type of blood pressure medication you get really depends on a number of things, but principally your age and also your ethnicity. So where you're from. And there's quite common drugs. The most common drugs we use are called ACE inhibitors and calcium channel blockers. So depending on whether you're over or under 55, you'll get one or the other, and depending on where in the world you're from, you may get one or the other as well. Once you start high blood pressure medication, it's generally long-term, generally for life. Although some people who have significant lifestyle adjustments, maybe lose a lot of weight or improve their lifestyle, can sometimes stop it. But generally, once you start it, it should be for life. And the reason for this is that to get the long-term benefits for the pump, which is the heart, and avoid heart complications, and get the long-term benefits for the end organs, the brain, the eyes, the kidneys, you really have to control the blood pressure to normal over a long period of time and not over a short period of time. And therefore, once you start a blood pressure medication, you should regard it as a treatment that you'll be on for life.
Okay, very good. So that's very informative. That covers management and treatment, which were my next two questions. Anything else to add, essentially, to the whole process? I suppose key takeaways for someone who is worried or has recently found out that they do have high blood pressure.
Well, the first person who is worried, get your blood pressure checked. If the spot blood pressures are raised, get a 24-hour blood pressure monitor to be sure. And for somebody who's recently diagnosed, patients do find it quite stressful to be told that they have high blood pressure, and very often it's the first long-term medical condition that a patient has, and the thought that they may have to take a medication or a tablet every day for the rest of their lives to remain healthy can sometimes be quite stressful for people. But what I would say is that, well-treated hypertension, patients have really good outcomes, and you're far better off to be on a medication, have well-treated, well-controlled hypertension, than not to be on a medication and have out-of-controlled hypertension where the pump, the heart itself gets damaged, or the end organs, the eyes, the kidneys, the brain can get damaged by the high blood pressure. So, and like everything, lots of things come back to our own behaviours, maintaining a healthy diet, healthy weight, being physically active, avoiding smoking, not drinking too much, and getting enough sleep. And then again, I would encourage people who may have sleep apnea, and again, that's a topic that we can do on another occasion, that if you do have sleep apnea, and that principally is people who snore heroically, who wake up tired in the morning, who may fall asleep during the day, that's another condition that can be very effectively managed, and that can help to lower your blood pressure as well.
Okay, very good. What about those watches that monitor heart rates, and is there any functionality of wearable devices and that type of stuff?
Wearable tech is becoming more and more, I suppose, popular. I'm not aware of any CE approved kind of watches that can check your blood pressure. I know there are different devices that can check different metrics, but an actual blood pressure check, in my opinion at the moment, requires a bit of kit, slightly more than a watch, I think. So you need to get an actual blood pressure monitor. But I'm sure that the engineers will figure this out in years to come.
Eventually. Okay, all right. Well, look, next week we might tackle sleep apnea. If anyone has any questions around high blood pressure, we'd be more than happy to address them on next week's episode as well. And if anyone wants to come on and have a chat with us about any common conditions that they feel like they might have insights into, or might add a bit of expertise into, we'd be more than happy to have anyone on. I'll leave it at that, and we'll have a chat again next week. Dr. Nick, thanks so much for joining.